So you've been invited to join a Balint group, but don't know what it's all about. In this video, we hope to give you a quick overview of what a Balint group has to offer the 21st century GP or GP trainee. Before we start, here are some questions to think about. How important is your frame of mind in patient interactions? Are you even aware of your frame of mind during consultations? Are there patients that stay on your mind long after the consultation is over? Perhaps you're wondering why these questions even matter. Let's look at the following scenario. After many years of hard work and learning, you're finally a working GP. You're a part of a wide network of professionals providing care to those who need it. However, during your actual consultations, you start to realize something. Your working life now mainly consists of you working with patients in a one-on-one setting. Many bring confusing and complex problems that aren't always easy to solve, and you realize it's somewhat lonely an existence and you feel isolated at times. As a GP, you make much of the decisions with that patient alone, and you make them based on your understanding of what happens during consultation. Decisions such as these are tricky interactions between facts and feelings. That is to say, the decisions doctors make are not purely rational. They also rely on an affective emotional state. In the words of Pat Croskery, rational thinking and objectivity in clinical decision-making are determined by cognitive and affective dispositions. Making decisions as a doctor is a human act, one that is influenced by cognitive and affective dispositions, and these affective states may compromise cognitive control, and therefore the efficacy of clinical decision-making. But how do you deal with this tension between the rational mind and the emotional mind? Well, joining a Balint group could be the answer. Michael Balint was a Hungarian psychoanalyst who moved to London and worked at the Tavistock Clinic in the 1950s with GPs. At this time, the role of the GP was changing a lot, and rather than using a top-down approach to consultations, GPs were made to work within the communities. Balint ran research groups with his wife Enid, who was a social worker, and published his findings in his seminal work, The Doctor, His Patient, and the Illness. These groups Balint ran provided transcripts, the first research in general practice that examined the two-way relationship between the doctor and the patient. Balint was the first to recognize that the symptom offered by the patient might not be the real reason for their attendance. Furthermore, the emotions triggered in the doctor by the patient could have a powerful effect on the consultation. He described a method of transforming uncertainty and difficulty in the doctor-patient relationship into greater understanding and meaning, a method that could nurture a more therapeutic alliance between clinician and patient. He came up with the term, the doctor as the drug, the idea being that sometimes the most beneficial element of the consultation was the dose of the doctor. However, Balint's work didn't just focus on finding ways to understand patients better. He demonstrated that doctors can benefit by telling the story of their patients in a safe, confidential space. And you can read about this in a later research book by John Selinsky called What Are You Feeling, Doctor? Whilst Balint proposed the use of Balint groups to improve the relationship between patient and doctor, they've been now shown to have many other benefits. Balint groups increase self-reported psychological medicine skills. They increase work satisfaction. They increase empathy. And they reduce burnout syndrome amongst primary healthcare doctors. Nowadays, Michael Balint's methodology is used all over the world. But what actually is a Balint group? So a Balint group is usually made of 6 to 12 doctors that meet regularly, either on a weekly or fortnightly basis. Each Balint group usually has 2 leaders, or 1, whose aim is to create a safe place, discourage intrusive questioning, and keep the discussion focused on the doctor-patient relationship. The discussion is based on psychoanalytical principles, and the group relies upon confidentiality and respect between its participants. During the Balint group, someone volunteers to talk about a patient who's been on his or her mind, and the focus of the story is usually a residual emotion from the interaction, such as anxiety or sadness, or a sense of being stuck. Because they focus on the psychodynamics and transference and countertransference issues of one doctor-patient relationship, there can be misconceptions. For those outside the group, they might wonder, is it therapy for doctors? All they seem to do is talk. Does anything happen? Shouldn't the leader know all the answers? Or they seem to come out feeling puzzled. What use is that? What makes Balint groups so different from other methods in medicine is that there is no need to offer a solution, and they're not there to make people feel better. Instead of trying to solve a problem, the group mirrors how to hold the uncertainty, the not knowing, in a compassionate and accepting manner. So Balint groups help participants to transform uncertainty, confusion, and difficulty in the doctor-patient relationship into understanding and meaning. Ultimately, this nurtures a more therapeutic alliance between clinician and patient, with doctors being more comfortable in their interactions and also in themselves. So Balint groups usually meet physically, but over the last years, groups have run virtually using platforms such as Zoom. There are many active groups, and the best way to experience a group is to attend one on your training scheme or to contact the Balint Society and join one of their many day events. So the next time you have a difficult interaction with a patient that lingers on your mind and you don't know what to do, maybe consider joining a Balint group. That way you will have a group of people to share the interaction with, a group that will help you to practice transforming uncertainty and confusion into understanding and meaning.